And my dear sister, Sister Sally as we call her, and my oncologist, Dr. Gail Roboz of New York Presbyterian Cornell. Wow, they're here. Good to see you. You're on my turf now, Gail. I'm usually in your turf, but I appreciate you because there have been so many questions that have been asked. But if you don't mind, I want to start with my sis first because it was, what, Tuesday and Wednesday you went through the collection process, and here you are on Thursday. How are you feeling?
I'm feeling just fine. I'm just, my heart is with you right now, and it's also with all the people in my community who are going through Isaac in New Orleans. And I am praying for all those who are suffering right now as a result of Isaac, and I'm feeling so good. I'm going to be back on the air on Saturday on my station, and that's what people need to know, that the recovery time is so very quick, that I feel 100%.
I know, and the whole way you have been, you said there was no real discomfort in what you were doing, and just forever grateful. Just forever grateful when I see that. Gail, help people understand. I know when I first came to you, I'm looking to the heavens and going, what exactly is this, and how did this happen?
People can't even say myelodysplastic syndrome, let alone understand it. And I think the fundamental thing is, what's bone marrow anyway? Bone marrow is the factory that makes your blood cells. And it can be damaged along the way. It can be damaged by chemotherapy that you got for something totally different. It can be damaged by radiation, or sometimes it can be damaged by things that we don't know what they are. We don't understand. I think the majority of MDS patients out there and watching this are saying, how did I get this? I didn't do anything. I didn't get chemotherapy.
And I went through pre-treatment with you, and it was a mild form of chemotherapy that I didn't lose my hair or anything like that. And people remember at the end of July, I had a really bad day on the air with a clenched jaw, and that it's, to keep it real, I was pleasantly surprised that it wasn't that difficult, but there are those moments, Gail.
Absolutely. I mean, the type of chemotherapy that you got allowed you to be here looking fabulous, coming to work. Not all types of chemo do that. But you remember our conversations. You've got to be careful. You've got to watch it. If you had a symptom that was new, you got to call us right away, which you did. And it was nothing, and that was great, but we checked you out pretty carefully.
And people want to know now. Everyone keeps talking about these first 100 days, and Sergio Gerald, who will be doing the actual transplant at Memorial Sloan Kettering, said it is not a process, it's not surgery. This is actually a journey. Can you help people understand what's ahead?
The first part when you get into the hospital is a schedule. You'll have a calendar, there's going to be a special IV put in, there are going to be a few days of chemo, and then there is going to be the transplant, which is infused through the special IV. It looks like a bag of blood, and you wouldn't really know we were doing anything if we didn't tell you. You could sleep through the whole thing. But after that, the schedule gets a little bit less tight, and it's all about you, and every patient is different. We look at those first 30 days out as the time to rebuild your systems. So we wiped out your bone marrow, we wiped out your immune system, but Sally Ann's have got to find their way into that catheter, swim around, figure out where to go, and set up shop in you so that you get functioning blood and a functioning immune system again.
So the first 100 days also are so very key.
Well, even we're hoping the first 30 is when we're going to see a lot of that recovery happening, and we're protecting you during that time. You're getting some blood and antibiotics to protect your system until you're up and running again.
I know there's some isolation. We only have a few seconds left, and I'm not even going to ask you when I can come back, because you've said don't put a timetable on it, and just know that I'm going to get back here as soon as I can. I love you, sister.
Oh,
Thank
I love you, sister, and I'm going to be with you in that
you
isolation area,
Gail,
wearing my mask.
Yes, you and Sergio and your team.
Yes.
You are a dream team. Thank you so much.